Hello, good morning, good evening, everybody. I am Vaidya Asavari Manvikar. I would like to welcome you all to GCAR Global Webinar Research Series. GCAR, Global Council for Ayurveda Research, is an international non-profit organization based out of USA. Our mission is to educate, encourage, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your interest and skills. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today. I am very delighted to welcome Vd Prayag Sethiya. Namaste. He is traditionally trained Ayurvedic Vaidya. He completed BAMS MD Panchakarma from a prestigious Tyak Ayurved Mahavidyalaya, Pune, in 2015. He is a gold medalist. He completed MA in Sanskrit from Tyak Maharashtra Vidyapit, Pune, in 2016 and PG diploma course in yoga therapy. He is very grateful to Vaidya Dhananjay Kulkarni, Vaidya Swati Kulkarni, Vaidya Narendra Pense, and Vaidya R.B. Gokte sir. He received special teachings from all of them. He has been practicing Ayurveda for more than last 10 years. He works as a physician at Seth Tarachand Ramnath Charitable Ayurveda Hospital. He teaches at PG Diploma course in Panchakarma at Tarachand Hospital. Under Vedanta Ayurved Kendra, he has been conducting various student-oriented activities, preparing and providing Prashaman, an Ayurvedic first aid kit for patients. He conducted 6 Basti Adhyay Karyashala, a 3-day offline workshop for various aspects of Basti Chikitsa. He wrote a Marathi book, Maitri Ayurvedashi, with the aim of helping even school students understand basic concepts of Ayurveda. He is a co-editor of the book Charak Kalpasudha. He received Yashasvi Yuva Vaidya Puraskar in the memory of Anna Lavankar sir for pharmacy, Lidgen Pharmacy in 2014. So thank you so much, Vaidya Prayag, being here. I would like to pass on to you. And we are all eager to hear about skin diseases and how Ayurveda could be very, very helpful for managing them, and also looking at the case studies that you have been working so many years.
So much, ma'am. I'll start with a short prayer. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Kadavavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Thank you. I would like to start today's session by expressing my utmost gratitude towards all my guru and teachers, because of whom I could become a passionate student of Ayurveda. And basically, all of my teachers, which I respect them most, they taught me how to learn Ayurveda. And that's why even after coming out of the college era and being stop being a direct disciple and direct learning from my teacher, I could still study in the similar fashion on my own. That was the biggest gift given to me by my teachers. Secondly, I am sincerely grateful to Asavari ma'am and Patankar sir again because giving me this platform to share my views. I have been reading the list of the lecturers and eminent speakers which have guided the audience here before, and I could see names like Suru sir and so on. So I think it's my responsibility to contribute from my side and to make sure that at the end of 1 hour, everyone from the audience would get some positive input from my side. Being said that, I'll move to my to this topic, and the title of that the lecture which I chose to give was learnings from case studies of Kushtha. I'll just have a brief introduction regarding what is my thought process and what I intend to deliver in today's session of 50 minutes. Uh, Generally, as a practitioner, when we gradually settle and we start seeing more and more patients, it becomes a certainty that our connection with the core principles and Shastra start becoming weaker because we get less time, we are more engaged in other activities. And so sometimes our practice becomes a repeated manner, ritualistic fashion, and we tend to lose the grip of the Samhita and Shastra. But in that flow, we also tend to lose the very important insights which help us in the difficult cases or where intended result is not being achieved, and that happens most in the various patients of Kushtha. So today I'm going to present in front of you 4 to 5 case studies. They are not going to be a detailed picture or point to point description, but some pickup points. As many times in today's era of Netflix or YouTube, we directly jump to the intended scene which we like in a movie and we skip the other part of movie. So my today's approach is going to be similar because I am pretty much confident that what you want to learn from the session will come from listening to the different cases and not a single case in depth. So I have taken that liberty for myself, and before starting actual the series of different cases, I'll just provide few inputs regarding the Vyadi Kushta. I know many of us they do know these points, but as I mentioned that as we grow into the practitioner, we tend to lose hold of these basic things, and these help a lot. And I'm going to repeat those things when we are going to listen about different case studies. The first and foremost is the nomenclature. In Vedic sciences, the first source of knowledge is always from the etymology, or as we call the Nirukti. And the word Kushtha many times is the etymology is ignored because we are unaware of the same. But Ashtang Sangraha clearly mentions in its Samhita that Kushnahati Vapuhu. Now, Kushnati is a very wonderful word, wonderful in the sense of meaning. But the noun associated with the verb is Vapuhu. So Kushnati means one which harms or creates a trouble. But it is not Kushnati Twak. It is Kushnati Vapu. So we all should be very much aware of the fact that Kushtha is a Vyadhi which troubles the whole body at the same time. So even if we see a single patch located at some remote place around the ankle joint or so, before the appearance of that patch over the twak or skin, it has already spread out all over the body. And this is clinically very important because two things. Firstly, it gives you an idea that even you cannot judge a patient based on the size and shape of a lesion. Once a kushta has appeared, irrespective of its spread and size, it has already occupied the whole body. And it gives us an indication of a more possibility of need of a shodhan. And secondly, it discourages us, or it should discourage us to start with the external treatment aggressively in the initial phase. Because there are very classical references in the text that before, if you do a proper shodhana, you cannot go with the external applications like lepa, etc. So this insight regarding the etymology gives us the hint while treating the patients. Secondly, again, a wonderful insight by Charaka Samhita. He has rarely mentioned this in any other disease. While enumerating the types, Charak Samhita says, like other Grantha as well, that there are Mahakushtha and Shudra Kushtha and so on. But in the Nidana Sthana, he states Kushtha can be of infinite types. Why so? He gives three wonderful reasons. Firstly, the Anshamsha Vikalpana, which means a permutation combinations of different attributes, that is guna of dosha. Secondly, sthana, that is location of the specific type of kushtha. And thirdly, anubandha anubandhya, the predominance of the dosha. And I am going to again take the references to these points as I am going to go further into the case studies as how these points help us to fixate upon a treatment. Now, a question should arise in our minds that if Kushtha can be of infinite types, as a practitioner, you must be aware that number of patients of Kushtha, when they are going to get exposed on a regular basis, there is always some minor variation even in the similar diagnosis. So if the types are infinite, should be the treatments also be an infinite? It is practically impossible. So yes, there are both the answers to the question. Yes, treatment can be infinite, and no, it cannot be infinite. How so? The no answer conveys us that no, there is no need of infinite medicines. Medicines can be limited as they are mentioned in our classical text, but to tackle this infinite combination, we need our hold on the matra, that is dosage, kala, specific times, combinations, that is yoga, and along with that anupana and so on. So the yukti comes into the picture. So no, you don't require n number of combinations every time to tackle these infinite types, but you need a yukti which will make sure that you are utilizing the available options. Okay, and another point is that, which is very important, that all the kushtha are always tridoshatmaka. Nahi ekadosham kinchit kushtham samupalabhyate, as mentioned in Charaka Samhita. So one cannot find a kushtha having only one dosha involved. And why is it important? Because looking at any type of kushtha, we cannot go all guns blazing and go for ekantik pittagna, vatagna or kafagna chikitsa, because in turn it might aggravate the other dosha which is ready to get aggravated, because all the three dosha are culprit in the samprapti. And the next, the important aspect, especially in the regard of Kushtha, is its diagnostics as per Ayurveda. Now, just for a minute, forget about the Nidan Panchaka and other points, which are common in all the diseases. What distinguishes the Kushtha from other Vyadhi in the typology is the nomenclatures of the types. Charaka Samhita and all other Grantha have very beautifully given us the different names of different types of Kushtha. Now, again, we should be able to understand the relevance and importance of the same. It was very much possible for Granthakar to just give us the names Vata Pittaja Kushtha, Pitta Kafattara Kushtha, and so on, which we know by the nature of their Lakshana and Hetu. But they have not done that. On the contrary, they have made it easier for us to diagnose a Kushtha. How so? I just quoted an example. One of the types of kushta, that is charma kushta, which means hasti charmavat, like the skin of an elephant. So, based on the resemblance of the presentation as a whole, we get to see most of the types. Like it can be eka kushta. We are going to see the different examples. Why so? Because it is one of the most easy way to diagnose and fixate upon dosha and guna predominance. How so? Just we saw the fact that all the kushta have all the three dosha as a main culprits. They all the three dosha are vitiated and active in any kind of kushta. And so, if you say any kind of kushta, in general, patient complains of more or less itching. There is a discoloration. There are different kinds of utseda. There are eruptions, and so Sometimes their lakshan of vata, pitta, kapha, they all show them together at the same time. And if so, it becomes difficult to fixate upon a predominance of dosha only based upon the lakshan. And here Granthakar comes to the rescue. The vision of the Granthakar is that you should be able to first diagnose the Kushtha, then you can discuss about the dosha predominant. That is the beautiful help they are providing us. Like in this type, if you, just by looking at the skin lesion, you can say that this resembles the skin of the elephant and hence it should be known as the Charma Kushtha. Now you can go back to the Grantha, look about the Charma Kushtha, see about the predominance, and then you can fixate upon the specific अंशांश kalpana of dosha, guna, and thereby the treatment part. So this helps a lot in the practice of the Kushtha. I'll start with my cases in the same logic. The first case, Kitiba Kushtha. Now see, I have just mentioned the modern correlation for those who are new to this field or who are just started practicing. But the all the descriptive aspects of the diagnosis and treatment are completely based on our Ayurvedic diagnosis. So, Kitiba Kushtha. Now, again, as I told you before, I am not going to elaborate all the aspects of every case, but only the highlighting points which I want to underline. First, Kitiba. Again, what does the name suggest? If you so there are two variations of this name actually in the classical text, Kitibha and Kitima. But moving ahead of the same, Kitibha literally means something which resembles an insect like a bed bug. Kita, we all know the meaning of kita. Kita is an insect. And if you just see carefully the kind of lesions you could see on the leg of the patient I'm sharing the image about, they look like some kind of bug. They are all standing on the leg of the that girl. And now what becomes easier for me, even before I could ask the patient, is there itching, is there any kind of burning and discharge and so on, I'm able to narrow down to the typology of the question. And that is the biggest boost we get by this kind of diagnostic. Now, if you could see the exact lakshana which are given in the classical text about Kitiba Kushtha, so it is a Parusha. You can see that Kirnakarasparsha. Kirnakarasparsha literally means rough like an induration of a wound. And Shava, that is blackish in the color, which are all present in front of you. Now, there was another possibility if because of some reason I didn't know or I couldn't diagnose this Kushtha as Kitiba. I still have liberty and obviously the permission of Granthakar to diagnose it as a Vata Kafottara Kushtha. But what happens in the process? There are multiple other Vata Kafottara Kushtha. And we have to differentiate between them because as we just saw, their permutation and combinations are infinite. And by choosing mere Vata Kafottara Kushtha, it becomes a bit vague diagnosis. So the options about the treatment are much more. And so obviously we land into a zone of confusion. Whereas if at all you are able to narrow down to this kind of diagnosis, in this case which I could, what happens? See, I could narrow down to a specific yoga, which I have been using in this patient for a few months at a stretch. Ashtang Hridayakar beautifully conveys a kalpa which has got specific mention of the specific types of kushta. And surprisingly, kalpa is very simple. That is again the beauty of Ashtang Hridaya. Vidang Adrijatu Kshaudra Sarpishmat Khadiram Rajaha Kitibha Shvitradrugdham Khadet Mitahitashanaha. So what was the advantage to my side? I could diagnose it as a kitibha, so I could find a specific yoga. I could use that in a confident manner, and so obviously it was not the only yoga. It was one of the predominant yoga, as I mentioned. In parallel, I was also using the contents of Laghu Manchisthadi, and obviously varying the anupana, the matra as per the rutu, doshabal, etc. But the center point of the treatment what was this yoga. Again, honestly, Madhu and Gruta are the anupana, so it becomes only a very small combination of three medications: Khadira, Vidanga, and Shilajit. And after giving this kind of treatment for around 6 to 8 months, the current status of her leg is the one which I have shared with you. Obviously, the treatment is still going on, but most of the lesions are already gone. Just the remaining discoloration needs to be gone, and obviously it will take some more time because the dominance of kapha is more in this kind of Kritika Kushta. So the thing is that the learning this the change in this case, which I would like to share with you, is that if we thrive to make a perfect diagnosis, a more precise diagnosis, we can arrive to a precise kalpa, which are abundantly given in many of the Samhita, based on the Falashruti. Also, what common tendency we could see, especially in the patient of Kushtha, as I have mentioned before, because of number of symptoms appearing. There is a discharge and there is a redness, there is itching and so on. We tend to add different kalpa at the same time because we are not confident about our diagnosis. So if you could diagnose precisely, there is no need. It is not a necessity to choose a complicated, excessively potent kalpa in the first follow-up. Yes, there are extremely potent kalpa which are very well available with us, likes of say Rasamanikya and Sindur Kalpana and so on. But we need not start with them at the beginning. If you are sure about your diagnosis, you could take a precise kalpa of the herbal origin as well. And also, you can stop yourself from using too many yoga at a single time. I have experienced myself when we lack the confidence about the diagnosis, we tend to use more kalpa. We tend to use more herbs because we are not sure which will work and which may not. And we don't want to make the patient suffer because of our lack of knowledge. But in that process, what happens? We tend to follow the same practice ritualistically. Just like prescribing every patient a kvatha. Anyhow, it might be Mahamajitadi, Aragvadadi, as per the tradition, Akalpa, say Arogyavardhini, Gandhak Rasayan. And what happens in the process? Patient might feel better, but we cannot collect the wisdom based on the knowledge. I cannot tell another Vaidya that exactly which kind of medicine worked in what way. And this creates the limitation for our Shastra for the proper propagation. So, we want to become more affordable, more precise. And if you want to transfer our knowledge in a confident way, we can diagnose properly, choose the limited medication, and get the results. That creates a good Vaidya out of you. Okay? And I think the word was mentioned in the sutra, hitamita. So in the patient of Kushta, anyhow, not only limited to this yoga, need of proper diet and lifestyle. I have a single side A4 print in my clinic, which I mostly provide any soft copy or hard copy to a patient of Kushtha, underlining the importance of diet, what a patient should eat and what not. Because many times these patients move around and ultimately come to us. So they have faced failures already. And we know without uprooting the cause, we cannot cure the patient of Kushta. So we should not shy away from insisting the pathya, ahara, vihar, etc. And you can make a very simple document, but that creates a lot of difference. This patient specifically followed all my instructions. She was following not only diet but a good lifestyle, from getting up early in the morning to going to the exercise and doing that appropriately. And so all these things help her in a cumulative way. So these are few things which I could pick up again, and I am repeating that in all of the patient of all my patient of Kushta. Now another case again, similar resemblance Eka Kushta. The resemblance mentioned in the grantha about Eka Kushtha is like scales of the fish. The classical word mentioned is Matsya Shakalopama. The another descriptive part which comes in the verse is Mahavastu, that it occupies large surface. And Asvedana, there is lack of local sweating. And the I could get a very good picture honestly in the first follow-up of this patient. And if you could see the cracked pattern of the same, and it easily resembles the scale of a fish if you could just compare with the another picture of the fish. Again, as I was mentioning before, this made my diagnosis a very easy job. I need not think about dosha first. I thought about dosha afterwards because I could immediately know this is a classical case of Eka Kushtha. Now see, Eka Kushtha is also Vata Kapha predominant. Kitiba also was Vata Kapha predominant. And if I would have only looked at the dosha, I would have not been able to differentiate at the level of treatment. But now, if you could see minutely to the image I have shared, as I was talking about the Anshansha Vikalpana, about the dosha and guna, classically here Vata is more predominant. Why so? Because of the dryness, roughness, crack pattern. And so what I could understand is that here Vata is especially predominant with its Ruksha and Kharaguna. So if I could reach to such a certain level, I could be very much precise about my treatment. And what did I do based on this my diagnosis? Obviously, I followed the cue of Grantha. If you start with the treatment of Charaka Samhita, the sutra, the first sutra comes about the dosha pradhanya and treatment is that Vatottareshu sarpihi, Vamanam Shreshmottareshu Kushteshu is the first verse. And Agre is a word which is applied to the all these part of the treatment. So if this Kushtha is Vatottara, ideally I should indulge into the usage of the proper medicated Ghruta. That's how Granthaka states. Again, a use of Ghrutapana is many times ignored or limited to a few ones. Now, when I could narrow down to a kind of Ghruta, narrow down to a part of treatment which is a Ghrutapana, the second practicality comes into the picture is that most of the Ghutta which are available are Pittagna. If you could see in the marketplace, be it Tiktaka, Mahadiktaka, Panchadiktaka, we have few options like Panchadikta Gukul Gruta or Aragnata Mahadiktaka Gruta. But still, I don't have any kind of a very strong Vata Kushtagna Gruta available. So what should I do? If it is possible for you, see, it is not a big deal, honestly, to prepare your own small amount of Gruta, Taila, and so on. So I could narrow down to a specific combination in the Grantha. If you could open the Ashtanga Rudaya or Sushru Samhita, the first yoga of the Adhyaya, which comes in both of them, is a Siddha Gruta, especially meant for Vatottara Kushta, which the yoga which I have mentioned. I am not going to elaborate about the functionality of yoga. What I want to share is that the difference which you are able to see in the patient of the Kushtha has had been exposed to this Gruta for a long period of time. The patient lives in a distant town. I used to ship the Gruta to its place because I knew that this was his first line of treatment. So whatever recovery you could see is at the mercy of this Gruta. See, this is not available, but I knew that Tiktaka, Mahatiktaka, they have got predominant rasa as Tiktarasa, and I didn't want that in the this kind of Rukshakar Samprapti. And so I could use that and I could get these very good results. The thing is that the take home again from all for all of the Vaidya or Vidyarthi who are listening is try to prepare your own medicines as far as possible. Doing this small effort in your setup, which helped me a lot because I'm pretty much sure using other ready-made Gruta wouldn't have given me such a kind of result. So you try to first fix it upon the most ideal option. Again, what happens practically? We try to fit the patient into the yoga which you know already or which are available in the market. But what I have learned very thoroughly from my guru, from my sir, that he always tries to find the most ideal yoga and then he will care about or think about being available or not. If not, he will explore all the options of preparing the same and ultimately give to the patient. So that's how an ideal practice should work because the patient is our first and foremost objective. So this was what I could achieve by following the Granthokta line of treatment and preparing the expected medication. Okay. Next patient, she was suffering from Vipadika. Again, I am very well aware that we all know this diagnosis. It is not something new. The thing is that the only mere cracks or cracked heels is a different story. A kind of Kushtha Vipadika is comes with a package. As we saw, it is not only Ekadoshatmaka. Cracks are predominant, yes. But what you could see, what I could see was cracks on palms and soles. They were surrounded by thickened black patches. That's one thing. Secondly, there was severe itching. The usual cracked heels does not exhibit the itching factor, but this being Kushtha, I could see a lot of itching at the local level and the roughness. So if you could narrow down to the predominance of dosha, all the three dosha are expressing themselves in some or other manner. Like cracks, they are attributed to pitta or vata or both at the same time. Itching can be because of kapha, also it can be because of pitta, but in her case, it was because of kapha. The obvious discoloration and roughness because of vata. Now again, when you see this kind of picture, it becomes again clear that all kinds of Kushtha come as a package of all the three dosha. But it is difficult to underline a predominance only by enumerating the symptoms. More the symptoms dominant the dosh cannot be a formula. You need to also see the weightage of the dosha based on the severity of symptom and the hetu bala. Now, in this specific patient, a strong history of constipation was there, which was indicative of viloma vayu, viloma apana vayu. And the second and most important thing in the samprapti was around her menopausal age, when she had an episode of excessive bleeding, ati raja pravartana, she was advised the allopathic medication for stamban. And yes, the bleeding stopped. But thereafter, there was a significant appearance and aggravation in the kind of skin lesions I just shared the photo about. And it gives the biggest hint, and the your treatment protocol is completely dependent on this kind of facts. So obviously, in this patient, in initial few weeks, I was using the usual shaman chikitsa. But this Shamana Chikitsa, the likes of Gandhaka Rasayana and Mahamahistadi Kadha, even usage of Gruta, Mahatikta Gruta and similar Gruta in Shaman Avastha didn't yield the expected results. And when I reviewed the failure, what I found was because of Leela Bahudosha and Vata predominance, I couldn't get the result which I was missing in my diagnosis. Now, Leena and Bahudosha, how I could find that? Because of the long-standing hetu. And Vata predominance was in front of me, but again I was using a wrong gruta and long line of treatment. So what I did, I changed my approach from Shamana to Shodhana. And that Shodhana obviously was with the thorough Purva Karma of proper Grutapana and thereafter Virechana. So what it do? What it did achieve? I think they did result in next few weeks, which I couldn't get before. And because the proper choice of Grutapana, the properly administered Virechana, and obviously the compliance of the patient. And the difference was very conspicuous. It is what I would say clear in its symptomology. And the message which I learned, the lesson which I learned, and I tried to follow thereafter is that matter a lot. We take the history most of the times, but we tend to forget or ignore these points. But history gives us hetu and samprapti. If we ignore those, we get the failures in between. Second point is that other associatory complaints should be taken into consideration. As I was mentioning, the Viloma Apana Vayu. So what I did was obviously in current, she's still under treatment. A combination of medication is constantly going on, which keeps her Apana Vayu under the check. Some Snigdha, Mrudu, Anulomana. And along with that, I am giving her some medication now for the Sheshadosha Shamana. And that helps the patient to a faster recovery. And the point which I want to highlight here is that significance of Shodhana. We all know Kushtha Vyadhi, all the Granthakar emphasis about the Shodhana. In the our graduation days, we used to write a sutra like Pakshat Pakshat Chardayet, Masan Masan Virechar, and so on. But somehow we tend to forget about the significance of Shodhana as we come to the practice. But a hint, one of the hints about when to be aware that you are missing onto the Shodhana is what we could learn from this case is that if you forget about Shodhana when it is indicated, you are reminded of the same when the disease, the Kushtha, is regressing, but in an unsatisfactory way. Or in spite of all your appropriate efforts from the Shamana side, it is being non-responsive. So you should remind yourself that this must be Bahudoshavastha and you might be missing out to the Shodhana Chikitsa. So this learning, which especially is important in the Kushtha types, which I could be able to replicate in other patients, and those gave me a better results than Shamana Chikitsa. Now this is a school-going child, a girl, 12 years old. I am not giving the name to begin with, but the presentation again is very simple and very straightforward. And I am just trying to write the all the symptoms which you could also see. So the patches are circular. There is a specific coloration in the middle and a border at the same time with a different color. Slightly raised borders. The nature of the touch was smooth or unctuous. In the progression of the disease, these kind of circles, they tend to sequentially join each other, but the spread was very slow. These are the presentations of this kind of Kushtha. The peculiar observations which helped me to narrow down to the more specific treatment was that specific school girl was very thin for her age and for her comparative age group. And also, her teeth specifically showed white discolorations. They were thin, they were serrated. In the shortest possible way, they were indicating the asaratva. So these were some specific points which helped me in the treatment part, which I'll share soon. And one thing which I could obviously find in the case history was excessive consumption of the sweet items. So now again, sequentially learning about the same, this explanation of the symptoms can be easily seen, giving a direct correlation about Mandala Kushta. See, the verse is in front of you. Shvetam Raktam Sthiram Styanam Snigdam Utthana Mandalam Kruchram Anyonya Samsaktam Kushtham Mandalam Uchyate. And I have just written the translation of this verse, which is very much similar to the presentation. So I am not going to again read out all the translation. It is very simple and in front of you. But it was obviously a type of Mandala Kushtha, or not a type, a variety of Mandala Kushtha. Why I am saying a variety of Mandala Kushtha? Because don't forget about the infinite possibilities, and these possibilities come many times in a way that a single type presents you with different formats and appearances. So this one Mandala Kushtha is where I could see the combination of Vata Kapha equally in this Rugna. But the most important part is the association of Krumi. Now, obviously, it was derived from the Hetu because the sweet items were being consumed most. Also, the traditional examinations in the Ayurvedic field, which we do to conclude the presence of Krumi, the couple of them. Firstly, there are black spots on the upper part of the Shweta Mandala, that is Shweta Mandala of the Netra. Secondly, the discolorations which I mentioned about the teeth, they are also found on the nails, the white spots, which are very common in this kind of presentations. So this gave me an idea that this Rugna was not only suffering from the Kushtha, but also with the Krumi. But story is not complete here. When in the phase of learning, I went to the Pitru Samhita. I'm going to mention that subsequently. It establishes a strong correlation between Kushtha and Krumi. And if you could see, many of the important yoga and dravya in the Kushtha are potentially Krumigna also. What I used in this patient specifically was a combination of various drugs from the yoga of Lagu Manjisthadi, which I have narrated in front of you. As she was lean, a bit of Durbala, and looking at her age, I didn't put the vacha into the picture, but I used Patol instead. That was a minor change. But a specific Falashruti from the Lagu Manjisthadi, which was helpful for me for its choice, was Rakta Mandalam Nashayet. What more do you want? There is a Raktatva and Mandalatva. So yes, this becomes a very specific medication for this kind of presentation. And obviously, along with those, Gandhaka Rasayana and Mahatiktaka Gurta, obviously, in the different phases, I was using in this patient. And what did I get? This picture nature of the leg of the patient. She's off the medication and she doesn't require any kind of help from my side as well. But how I could achieve the same? Obviously, Hetu Parivarjan is a part of the treatment, but the learning which I underline in this case study is that, which I have mentioned before also, I could narrow down to a specific type of Kushtha. and that gave me a very good choice about the yoga as well. And especially in the young, at a young age or in the children, the learning which all should remember, because in as Patankar sir was mentioning beforehand, that because of the very unusual food habits nowadays, many small children are coming to us with the diagnosis of Kushtha. And the thing which we should not forget about, especially Kushtha and the small age, is that there is going to be a very common association of the Krumi. And as I was mentioning about the Sushruta, Sushruta states that forget about the age. In every patient of Kushtha, an association of Krumi is going to be there. He states, Sarvani Kushtani, Savatani, Sapittani, Sasleshmani, Sakrimini cha bhavanti. Sushrut doesn't hold himself back. He says Sarvani Kushtani. So all kinds of Kushtha have involvement of Krumi along with other dosha. And this gives us a very beautiful insight. I'll just quote a small anecdote that the usage of Vidanga in Kushtha is many times forgotten. We limit the Vidanga to the grooming the property and forget about the other aspect. If you could explore the different yoga, different usage of Vidanga or Kushtha Chikitsa, the Vidanga has come abundantly in the Kushtha Chikitsa. And after learning these things, which I started using Vidanga, likes of Khadira Rishta, Bhrungarajasa or Bhrunga in more frequency, I could fetch better results. So these small anecdotes give you a lot of information. And in the second most important aspect is that think about Rasayan early in the treatment. The very important lesson which I could learn from my sir, that in small children, even though they are exposed to a different kind of apathya, viruddha ahar or so, still their hetu bala is much lesser than when compared to an adult. So, with small exposure to the hetu, if there is appearance of kushtha, we should take into the consideration that dhatu bala of small children is obviously lesser than the full grown adult. So, we cannot just focus on the Shamana Chikitsa. We should also focus on dhatu because they are anyway alpasara. So, unless we give bala to the dhatu to fight against the dosha, we are not going to get a proper relief in the children. And this is not only true in the case of Kushtha, but all the other Vyadhi which are seen in the small children. And therefore, you could see I was using Gandhak Rasayana from day one. It is a beautiful Shamana and Rasayana combination to be used in the Kushtha. I also used in the latter part Mahatiktaka Ghruta. The predominant content of Mahatiktaka Ghruta is Amalaki, and Amalaki is Vayasthapananam Agraha. So, this kind of assessment of available yoga increase their spectrum, and you could use them at multiple other instances as well. So, these learnings are most important, which I would I had in my mind to be shared with you. Now, as I was mentioning that these two cases, which one was the school girl and the one which is in front of you, they both have Mandala Kushta, but presentations are drastically have got differences. You could see circular patches, but they are not as circular as they were in the previous patient. They have got good amount of utseda. The color patterns are different. The expanse is different. And so these again makes us think about the Amsha Vikalpana at the level of dosha and guna. This female, she was 37 years old. She was a homemaker. And again, this kind of extent of Kushtha was there, but the was predominant than Vata, which I could understand from the color, from the appearance, from the itchy pattern of the Kushtha. The spread was slow but steady. Again, the classical nature of Kapha dosha is always chirakari. And so it was one of the few important points which helped me to fix it upon the kapha. And again, as I had mentioned about the specific locations, sthan of Kushtha, these patches were predominant, abundant at the level of joints in this patient. They were there at the level of below knee as well, but around the elbows and the shoulders, those patches were also predominant. So this gave me enough hints to fix it upon the kapha dosha, but this was not it. The in the examination, when I was just looking for the Darshana Sparshana Prashna Pariksha, what I had drastically Shithila Dhatu. Shaithilya was very predominant. And how I could diagnose the same, how I could conclude about the same. Firstly, there was a thorough laxity in her muscles. While examining her calf, that is Pindika, her abdomen, I could easily feel, I could easily grasp, perceive the touch, which was drastically Shithila. Secondly, she was physically thin at the same time. So we generally think about the Shaithilya only when think about the Sthaulya or Prameya and so on. But this specific patient was suffering from Panduta. She was lean. At the same time, her sparsha of the Snayu and Mamsava Shithila. So from all these observations, I could fixate upon the Shaithilya, and I knew I couldn't use the usual approach. I had to think about Shaithilya, especially while assigning the specific kalpa. And therefore, the kalpa which I chose in the sequence of the treatment, the firstly, Maha Manjtadik Vatha, obviously one of the most famous kalpa, but a specific falashruti which has come into a specific phala which has come into the falashruti is Medo Dosha. So Medo Doshe, a Saptami Vibhakti word, which has come into the falashruti of this Vatha. And obviously, if this kalpa has capacity to reduce the improper, inappropriate excess medodhatu, it must be helpful in reducing the Shaithilya. That was the thought. Secondly, again, a very wonderful Shaithilya Nashana, yet Kushtagna combination found in Vagbhata, Daru Haridra, Khadira, and Nimba. We all know that all these three drugs, they are very well in reducing the Shaithilya, especially Darvi is Agriya in Sthaulya. So you can just go on and on about each and every herb. But the long story short, these all dravya, they are Kushtagna and Shaithilyagna at the same time. But a step ahead of the same, that this patient was lean, thin, a bit durbala at the same time. So I cannot go on the extreme apatarpan mode. And I wanted to make sure while reducing the kushtha, her dhatu should not be exploited. So I had to choose few kalpa from which I fixated upon the tapyadi, that is Yogaraja, which comes from the Pandu Chikitsa. And also I was using Rasasindura in a very small dosage. Now, the concept of using the Tapyadi and Sindur at the same time has come to me from the reading of the Charaka Samhita. Because there is a very wonderful verse given in Charak Chikitsa Sthan. In the Kushta Chikitsa, obviously, Sarva Vyadi Nivarnam Adyat Kushti Rasayancha Nigruhitam Vajra Shilajatu Sahitam Sahitam Va Yogarajena. So, Rasam here means Parada. But parada cannot be used singularly. The most efficient combination of parada which is available is sindur. And Charaka Samhita itself states Yogaraja Churna in the Kushta Chikitsa. So a kalpa which is efficient in both Pandu and Kushtha, which comes down to the Yogaraja, or in our language, Tapyadi. And therefore, in such a kind of patients which are lean, thin, they have Panduta, they have Asara Raktadhatu, at the same time, they are facing the Kushta Lakshana, the Tapyadi Yoga becomes a boon for these kind of patients. And by using Rasa Sindhura, we create the yoga vahitva in the combination, the sukshmatva in the combination, and it fetches the result in the lesser amount of time. And obviously, along with the same, I had planned a shodhana in her, and the currently she's on the long duration she's on to the Mahatiktaka Gurta for long duration. Now, another point which I want to make here is that the usage of Siddha Gurta in multiple ways. So I had used Mahatiktak and Tiktaka as per the requirement as a Purva Karma of Shodhana, also as Shamana in obviously Vata or Vata Pitta predominance, and also as a part of Pashat Karma. This third point we tend to forget, but Charaka Samhita significantly gives us a sutra about the same. Charaka Samhita says, Snehasya Panamishtam, Shuddhe Koshthe Pravahite Rakte, Vayur hi Shuddha Koshtham Kushthinam, Abalam Vishadi Shighram. So, especially to replenish the bala of Kushtha of the patient after the Shodhana, to control the Vayu which might aggravate after the Shodhana, we should think about the Ghrutapana after the Shodhana is over. In many patients, after you give Shodhana, obviously in the Kushtha patient, for few days patient is settled, but again small appearances or eruptions come back. And at that point of time, if we could use we could make the proper use of the Siddha Ghruta, those remaining Vatottara dosha pradhanya goes down. So after doing all these things, this case obviously is still under my treatment, and different at different phases I use different yoga and shodhana as I mentioned before. And now patches are limited only to the specific joints like knees and elbows, and all other patches are completely gone, and still obviously in the recovery mode, and she'll require treatment for a few more months. But what I could understand and learn from this case is that while treating the kushtha, while treating the dosha, we should not forget about the dhatu, especially the quality of the dhatu. And they matter in the prognosis and the treatment. More the Shaithilya, the patient will need longer span of treatment, because Shaithilya comes slowly and grows slowly. And therefore, the usage of the kalpa like tapyadi and so on hold a very huge value in the treatment. Obviously, need of Rasayan Chikitsa from the beginning, Yogaraj or Tapyadi is said to be one of the most important Rasayan Kalpa in the Pandu or Kushtha. So obviously it was being used. Secondly, appropriate use of Siddha Kruta, as I mentioned before. Shodhana more than once. There is a very wonderful sutra in Charaka as well. Bahudosha samshodhya kushti bahusha anurakshatah pranam. Bahusha samshodhya. So we need a good counseling capability, and we should be able to convey to a patient that you might need multiple shodhana in the following treatment. And if so, then patient becomes ready for the same. And I have seen the benefits of the repeated shodhana. So many times our objective is that doing single vamana or virechana should pull the patient back from the kushta, but that is not what Grantha expects us to do. So multiple shodhana might be required. We should not forget about the same. Okay. Last in this series of case studies, which was about the Charma Kushtha. Again, this Charma Kushtha had a variation with a significant Pitta Anubandha. Generally, Charmakushta has Vata Kapha predominance, but I could see the Pitta predominance in the same. And she was a female patient of 48 years old. She had again itching, burning when exposed to the soap or detergent water, and so on. And cracks, which are obvious in the image, they were obviously exhibiting the pain when they are getting wider. So again, the presentation of Vata was also there, Pitta is also there, Kapha is also there. I needed to juggle between Lekhana, Ropana, and Kledoshoshana. Now, these are Virudhupakrama. I cannot do the same, all the treatment with a single herb. So, I need to reduce Utsedo also. I need to reduce the cracks also, and also the itching. And again, as I had mentioned in the beginning of my presentation, this is a classical nature of the Kushtha, that all the three dosha present themselves. But in this specific case, all the three dosha were pretty much active or at par with one another. So what I had to do, I had to treatment which can take care of all the three things at the same time. And in this kind of presentations, use of multiple kalpa at the same time helps. So I was using the Rasayan kalpa, Gandhaka Rasayan, also the likes of Khadira, Indrayava, Sariva, which are obviously Kashaya and Madhura combination when we combine all these three together. So Kashaya and Madhura Rasa, when used in combination, they also do Ropana, and at the same time, because of likes of Khadira and Indrayava, Kleda Shoshana can be also achieved. And the most important is Tiktaka Ghruta. Again, a beautiful property of Ghruta of Samskarasya Anuvartanat. So all the Tikta Dravya were doing their bit in reducing the Kapha and Pitta. At the same time, Ghruta was dealing with the Vata Pitta angle. And so this Tiktaka Ghruta was obviously my drug of choice and is still being used in the patient. And obviously, the matra was being changed as per the presentation. Now, in the 12 patient has added into this kind of presentation, and obviously the treatment is still going on. And I'm pretty much sure in the next 3 or 4 months, this presentation will be completely subsided. The thing is that which came to me while I was studying about the same, again given in our plain sight in the Charaka Samhita Kushtha, doshasya yasya pashyed kustheshu visheshalingam udriktam tasya eva shamam kuryat tatah paramachanubandhasya. A very important instruction for a treating physician. The patient suffering from a type of Kushtha, the symptoms can change from time to time. Sometimes itching becomes aggravated, sometimes cracks get wide open. So there is a very beautiful guideline given by Charaka Samhita. You should specify that dosha first, which is presenting the most severe complaint, and then you should shift your focus to the next one with the same logic, and you should proceed in the same line. So you cannot continue on a single medication for 3-4 months at a stretch. If you have to dispense medicine to a patient, don't exceed the limit of the a month or so, because there is a huge possibility that in the process of reducing one or two dosha, the second or third might get aggravated, and you have to shift from one type of treatment to another. So this is given especially in the Kushtha by Charaka Samhita, and I have been following this meticulously, especially in this the patient. So by doing that, I could achieve what I am being able to achieve, and I am pretty much sure with the same thought process from the Granthakar, I will be able to specify the remaining of the complaints. So these were the kind of things I wanted to put in front of you. The moral of the story is that all these siddhanta, all these principle, all these hints, instructions are given clearly in our text. But what we should do, irrespective of our nature of practice, the age, the bulk of our practicalities, we should not shy from reading the text constantly. We should be always able to recollect the siddhanta after we treat the patient, and we try not to be ritualistic in prescribing the medication. If so, only you and me are going to get benefited, because in each patient, as the Charaka Samhita mentions, siddhi can be achieved. Siddhi is something that is a constant success rate which can be maintained in different patients. So in a way, what I wanted to convey is conveyed by Charaka Samhita in the last sutra of the Kushtha Chikitsa. And again, I stumbled upon the sutra accidentally, and I felt it's somehow it is relevant here. Iti sangraha pranitaha maharshina kushthanashane adhyaye. That is fine. Smruti buddhi vardhanartham shishaya hutaveshaya. So obviously, every verse in the Samhita is Smruti buddhi vardhanaya. But Charaka Samhita wanted to mention somehow this specific word at the end of Kushtha, because repeated study of this kind of chapter where there is such a infinite possibilities. If you could study this Siddhanta repeatedly, if you could use those in the practicality, the way they will gain the Smruti and Buddhi in the sequence. And I'm pretty much sure that if we all could follow the same logic in our treatments, we all could gain from the study of Kushtha. And so, to summarize, as I always try to convey at the end of my session, that I am unsure that how much the audience must have benefited. But the most beneficiary of this session is me. As one teaches to learn, obviously I get to learn in the process, and so it is always a selfish gesture to deliver a session in this kind of manner. But again, to conclude, I would like to thank Asavari ma'am and Rajan sir, because they gave me this platform to share my views, and whatever you could learn, you could understand in the process is completely at the disposal of my guru and grantha. And if you could find some lack of knowledge or any lack of perception, it is completely my own limitation. So again, I'm very grateful to both of my these dignitaries, and I conclude my lecture here, and I pass on the mic to the Asavari ma'am. Thank you again.
Thank you so much. It was very, very insightful. Excellent, excellent lecture with lot of case studies and lot of details about those. I would like to open it up for questions. So anybody has any questions? Okay, so the lecture was so beautifully presented. Yeah, go ahead.
Ma'am, I want to ask one question to sir.
Mhm.
Yes.
सर
Go ahead.
मला
Yes.
असं विचारायचंय की जसं काठिण्य जाण्यासाठी आपण द्रव्य यूज करतो तर काठिण्य सॉरी शैथिल्य जाण्यासाठी तर काठिण्य जाण्यासाठी म्हणून स्किनच्या ठिकाणचं आणि वैवर्ण्य असं स्पेसिफिक द्रव्य आपण कुठलं यूज करावं इंटरनली घृतपान किंवा मग कषाय की गुटीवटी असं काहीतरी
म्हणजे तुम्हाला उच्छेद किंवा ज्याला आपण म्हणतो की रफनेस खरत्व असं म्हणायचं का ऍक्च्युअल ज्याला जसं किटीवर बघितलं होतं
नाही
आपण
सर
त्याप्रमाणे
माझ्याकडे सध्या एक पेशंट आहे तर
हम्म.
डायग्नोसिस मी तिचं केलं नाहीये तर फंगल इन्फेक्शन होतं तिला फंगल इन्फेक्शन तिचं कव्हर झालं पण आता काय एक्झॅक्टली वमनानंतर थोडंसं जे काय स्किन लेवलला आहे तिची पण काही ठिकाणी कठीण आहे काही ठिकाणी लूज आहे मोस्टली एल्बो जॉईंट पासून ते रिस्ट जॉईंट पर्यंत तिचं जे आहे त्या पार्ट मध्ये तिला सम पार्ट मध्ये काठिण्य आहे सम पार्ट मध्ये लूजनेस आहे असं तिचं आहे आणि स्किनच्या ठिकाणी वैवर्ण्य म्हणजे ब्लॅकिश कलरचं थोडंसं म्हणजे मुक्का मार लागल्यावर जसं ते काळं निळं पडतं ना सेम त्या टाईपचं तिचं झालेलं आहे तर मग
ठीक.
तिथं मी काय विचार करावा आणि कशी ट्रीटमेंट द्यावी
I'll answer in the English so that others also will get benefited. Why I'm asking this pointed question because many times we misuse the word Kathinya. If you could see, Kathinya comes as a Shleshma Prokopa Lakshan. Shleshmana Sneha Kathinya. So the classical solidity, as we could see, solidity of the wood or table, that kind of Lakshana is known as Kathinya. Most of the times there is a roughness or that kind of specific texture like a sandpaper. If you could see at the level of tuak with the shavata, that is the blackishness, it is attributed to the vata dosha. So that's what I was asking that what exactly do you mean by kathinya? Anyway, I'll just elaborate on both the aspects. If there is a hardness or as I have shown the picture of the Kitiba Kushtha and so on, you could see that there is an race pattern with the hard field eruptions. Then obviously you need a good kind of lekhana dravya, kashaya kalpana like kvath and churna in that format. But more than kashaya kalpana, you need proper selection of dravya. And externally, in this kind of kathinya, which I was mentioning about the kitipa, the gharshana or patrapottili helps a lot. Secondly, as you have mentioned, if the woman is already done, and if the blackish spots, a bit hardness or roughness is remaining, if you are sure that only that much the dosha remaining and woman has been a success by the removal of dosha, again I would recommend that it might be because of the components which are remaining, might be because of vata, and one should resort to the pitta kapha ghruta kalpana. Because I just mentioned the reference that if the shodhana is successful, the remnant of dosha have generally vata predominant. So either if it is kapha predominant, you go for the churna or kashaya kalpana having the kapha pitta guna or lekhana dravya. If you see that this roughness is there, there is a coarse texture is there, then you should resort to the siddha kruta kalpana. That's how you can differentiate. So first, what my message is that try to understand whether it is literally kathinya or it is parushya or kharatva or raksh. Okay.
Beautiful explanation. Thank you so much, Vaidya Prayag, for excellent, very, very informative and very truly, valuable presentation. So the knowledge you shared regarding all the diagnosis, treatment for, Kushta patients, it's very, very insightful. And what I get from, all your case studies, I mean, for everybody, the most important aspect is the emphasis on the proper Ayurvedic diagnosis. So you have to know about the Anshansha Kalpana before you choose any kind of Kalpana or any kind of yoga, and you have to look at the Falashruti. So at the bottom of the story, or what is really important is a deep study of all the Samhitas. Because if the foundation is not good, it's very difficult to use the right kind of yoga for achieving the best results. So I really appreciate how clearly you have explained all the case studies. Thank you again for sharing your years of experience with everybody, and I'm sure This lecture
Ma'am,
will be very
ma'am,
helpful for everybody.
hello, ma'am.
Mhm.
I have to ask one question.
Okay. Yeah, please go ahead.
Sir, good evening, sir. It was very enlightened session as usual. Sir, I have one question related. First question is related Kandu. Many cases we find Kandu is a very horrible symptom. So it very difficult to manage because sometimes patient will go to anti-allergic or some Kandugna like allopathy medication they take because of Kandu, like some PAMA cases or like the Dru cases. It's difficult to get rid of that Kandu. And second question is like some patients have like lesions uh, like acne, like mukhadushika on their face. It's like kapha pitta, and in head like on like dandruff, so it will be kapha vataj, like sticky. So kapha is there more, and here mukha dushika pitta is more. So it will be very difficult. Somewhere we have to give kaphagna chikitsa, and some in same patient we have to give pittagna. So how to manage that both doshas in one patient?
So honestly, Kandu can be a topic of a whole lecture, but I will try to just precisely convey what I think about the same. Obviously, we all encounter these kind of conditions, and they are very bothering to the patient. In the three steps, I will just put up my points in a short manner. Firstly, always stick to the diagnosis. Kandu is a symptom, not a disease. Generally, we don't diagnose a patient with a Kandu. It is Kandu in some Vyadhi. As you were mentioning, if it is because of Darunaka, it will be a Lakshana of Darunaka. If Mukhadushika, it can be the Lakshana of Mukhadushika, Kushtha, Shita, Pitta, and so on. And experientially, everybody could see that you have to choose a Kandugna Dravya or Kandugna Yoga from that Adhikaran. So secondly, if you are not sure about the diagnosis, at our for our health, there is Kandugna Gana from Charaka Samhita and Kandugna Yoga from the Shodhanadi Gana Sangraha from the 15th chapter. So what I do many times, if I want to use a specific Kandugna combination or Dravya, I try to find the overlapping set. The original diagnosis which I have made and the Kandugna Dravya from these either 4th chapter of Charaka or 15th chapter of Vagbhata, I try to see which kind of Dravya are fitting into the diagnosis. And using those obviously help the first thing. Secondly, many times if you could see, Kandu is one of the Bahudosha Lakshan. So in many of the cases, Shodhana is needed. And as I was mentioning about one of my cases, we should be able to diagnose that early in your case taking, that Bahudosha Avastha is there. And you should recommend a Shodhana, if possible, that will help when the patient is not getting relief by the Shamana. Now in Shodhana, Vamana and Rakta Mokshana, which are the obviously the most useful of the Shodhana. One missing point which I would like to underline is that in the Maharogadhyaya of Charaka Samhita, Kandu is a symptom given to the Pitta dosha as well. So Pitta Prakopa can also Kandu, which we tend to forget. And many times when we are not getting result from the Kafagna Chikitsa, cross-checking whether we are missing from the Pitta is what is more important. And the last aspect is that local therapies like Dhavana, Kashaya Dhavana, Jalauka Lepa, these kind of things also help us in reducing the Kandu. But honestly, going beyond the same and enumerating the herbs or yoga is not possible in short span, and the kind of the nature of the question is. So I will limit myself to this kind of answer. And if you want some more insight, you are always welcome to approach me personally. I can maybe construct a more elaborate answer. But that's what I would think about the Kandu in nutshell.
Thank you. Thank you for that beautiful explanation. And great questions, everybody. Thank you for everyone for attending our webinar. Please watch and subscribe to our YouTube channel to view all the earlier webinars, and this webinar will be uploaded to the YouTube channel very soon. Please like, comment and share all the videos. And once again, I invite you to become a member and also fill out our volunteer form. You can now also subscribe to our IU Update newsletter to stay tuned to our projects and also various events that we do timely. If you have any questions, feel free to contact us at Ayurveda Research USA at gmail.com. You can also reach out to me at asavari@mnayurveda.com. Thank you so much again. So we will conclude today's webinar here. Vaidya Patankar sir, do you have any thoughts or any comments?
Only one thought. We can give opportunity again to our Prayag sir for differentiation of Lakshanas in different case studies, because he has presented it very nicely at our one of CME. So that can be a good subject for him. Again, means as per your convenience, you can call him again for particularly this subject.
Absolutely, yes. We would love to have him as a speaker. It was very insightful, and thank you so much for introducing him. And yeah, the topic really, really is wonderful.
Correct.
Yep.
Okay, very well explained.
All right. Yep. Namaste.
Thank you so much. Thank you.
Yeah, thank you so much.